One day after President Donald Trump signed new childhood cancer legislation into law, we're hearing from Senator Shelley Moore Capito, who introduced the bill, along with Rhode Island Senator Jack Reed. Thanks for joining us for 7 News at 11. I'm Laurie Conway.
And I'm Tate Blanchard. Senator Capito said that this was a true bipartisan effort. 7 News reporter Catherine Guyan spoke to her this afternoon about this new law. She joins us live in the 7 Newsroom with what it means for cancer patients here in West Virginia and across the country. Catherine?
Tate, just to show you the impact of childhood cancer, according to the National Cancer Institute, 1,250 of the more than 10,000 children who were diagnosed with cancer in the last year will die from the disease. The goal of this new act is to work towards reducing that number by expanding opportunities for research while enhancing the quality of life for the survivors.
I'm pleased to sign into law the Childhood Cancer Survivorship, Treatment, Access, and Research Act of 2018.
Surrounded by lawmakers, childhood cancer survivors, and their families, President Trump turned legislation into law on Tuesday.
More than 15,000 children are diagnosed with cancer each year. Tragically, cancer is the leading cause of death by disease among American children.
This is going to help us in West Virginia, particularly at our research centers at WVU and in Marshall at the Children's Hospital.
Senator Joe Manchin also applauded the passing of the Childhood Cancer STAR Act, saying in a statement, quote, "No cost is ever too high to help a child, and I'm proud this legislation was signed into law," end quote. Part of that law includes caring for children who survive, making sure they have the best quality of life possible after the disease.
We know that sometimes after treatment, there are residual health effects from childhood cancer. You know, you can't treat childhood cancer the same way you treat adult cancer. So the more research we have, the better registries we have.
Registries will identify and track incidences of cancer, allowing research to be more specific and locating the best places to seek treatment.
When I listen to the parents talk, you know, one child was diagnosed, the mother stayed in Washington. The child and the father went to MD Anderson in Houston. Somebody else had to go out of the country for the specific kind of cancer. So we want to, these registries, I think, will help us cross-identify where the cancers are and those centers of excellence, too.
The next step is to fund this research. Senator Capito said that since she's on the Appropriations Committee, she's well placed to begin that fight.